this is me again. I'm going to explain about the run 2 and 3. The run 2, what is actually the run 2? This is, we call it open house. Actually, this is quite easy to understand. This means that we conduct an advertisement campaign inviting all the citizens of Barcelona and the other countries, all the citizens over 65 years old to come to our clinic to check their memory. It's quite easy, the concept, and they can sign up just through a phone call or via web, and importantly, they don't need to be referred by their primary care physician. So as I showed before, the campaign is going quite well. And to be honest, when we designed the project, we were very confident in this strategy, because before MOPEAD, we in Fundación ACE have been launching open house days for 10 years, and it had worked quite well always. Why is it going well? I think there are several reasons. The first one is maybe that the advertisement campaign we are conducting, I will say that it's quite appealing for the population. These are just some examples of the flyers we are using. This is our main slogan that says, if we do take care of our blood pressure, sugar, and cholesterol, why not taking care of our memory? I think this strategy is working well, not just in Spain, but in the rest of the countries. Another reason, I think, it's that it's quite easy to implement from a logistic point of view, because MOPEAD investigators we are directly in charge of this recruitment. This is the memory clinic staff who is conducting the pre-screening, so we don't need to subcontract, unlike the run 3 and 4, we don't need to subcontract other specialists or other institutions, and it makes the thing easier. And another important reason, probably the most important, is that the participants recruited through this run are very motivated to participate, because they voluntarily come and they see it as an opportunity to get their cognition checked, or maybe to collaborate in research. And it's quite important, and it's different from the other runs, as I'm going to explain now. Let me move to the run 3. Okay, it's in the same, sorry, it's in the same presentation. What is run 3? This is a pre-screening campaign at the primary care setting. Conceptually, I can say that it could be considered population-based screening. It's nothing different, for example, something very similar to the campaigns for early detection of breast cancer through mammographies. And, well, here we are having different difficulties in some countries. The first one, that we didn't expect, is that it was very difficult to engage PCPs in some countries, especially in the Netherlands. Our colleagues in the Netherlands tried different strategies through, for example, medical newspapers. They tried to engage the National PCP Association, and despite that, they weren't able to engage an adequate number of PCPs. In fact, I think that they have just 2 or 3 PCPs that are personal friends of the investigators. So this was the first difficulty we face. And what are the reasons for that? Well, we are not sure. Maybe some primary care practitioners have a negative attitude towards early diagnosis or screening, or maybe they have time restrictions in their clinical practice, so they don't have interest in research. Actually, we are not sure what is happening, but definitely we need to figure out this, because this will be one of the important learnings from the project. And to do so, we are preparing a brief survey about the opinions and the attitudes, a brief survey to be distributed among hundreds or thousands of PCPs in Europe to learn about their opinion on this topic. And the second lesson and the second difficulty we faced, but not less important, is that, as you can see in this pie chart, almost 1/2 of the people pre-screened as positive refused to proceed and attend to the memory clinic to a full diagnostic evaluation. This means that despite we told them that they could have an increased risk of AD, they refused to continue with the assessment. They argue different reasons. Some of them say that this is time consuming. Others say that they are not aware of having memory problems, or in other cases, the fear to a diagnosis of AD when no effective treatment is available. So to me, the big question here is whether we as a society, as a healthcare system, are ready for a population-based screening of AD. And probably accordingly to the MOPEAD experience, I will say that maybe not yet. Probably we need more education, not just to the general population, but also to the healthcare providers as well. And that's all from my side. Andrea is going to explain the next run.